Welcome to Podcast, the Business of Dentistry podcast, brought to you by Practice Plan. Podcast delivers the best business advice, real-life stories, and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
Hello, my name's Nigel Jones. I'm one of the directors of the Practice Plan group of companies, and it's my pleasure to introduce you today to the latest in our series of podcasts under the title of In the Loupe. We explore a variety of different topics connected to dentistry when we're doing this series, and it can be anything from NHS dentistry to cosmetic dentistry to all sorts of things. And today I'm absolutely delighted that we're going to be exploring a different subject to the normal ones that we explore, which is the gap between specialty care and general dentistry. And I'm going to be doing that in the company of Sonia Szamocki. Hi, Sonia.
Hi, Nigel. Thanks for having me.
Well, I'm delighted that you've been able to give up some time to have a chat with me today. For those people that are not so familiar with you and your background, I wonder if you could just introduce yourself so they have some sense of your perspective on this.
Yes. So I'm Sonia. I'm a medical doctor by background. So I trained initially and worked as an A&E doctor in London. Moved into the consulting world. So I worked for a company called the Boston Consulting Group for many years. Doing everything from consulting for luxury fashion, airline, mining businesses, but also obviously a lot in healthcare, given my background. So that was hospital transformations, community services, and anything really where there was a problem that it would be helpful to get some external brains into to try and solve. And then I went into medtech. So I was building technology for patients with rare diseases. So we're building a medical device that helps patients who have haemophilia monitor and track their treatments. And that's a company that was built from scratch and is now operational in Germany and is the leading kind of haemophilia app really in the world for those patients. And I now run a company called 32Co in London.
Okay. I mean, that sounds like an absolutely fascinating and hugely meaningful career that you've had to date. So what's brought you to dentistry then?
Yeah. So when I left, when I left that medtech sort of world, I took some time to think about what we needed to change things in healthcare, preventing long-term harm. But when we think about what your average person on the street is looking for, they're looking for treatments that help improve their lives. So things that are life-changing and not necessarily life-saving. And quite a lot of those treatments that we're seeing more and more demand for, things like dermatology treatments and fertility and treatments to help you with your sleep and treatments to help improve your smile, they are quite specialist in nature, actually, by which I mean you need an extra level of experience and training to be able to tackle those well. And historically, healthcare systems have trained a specific type of clinician to be specialist in those areas. And that's worked well for a long time. But what we see now, when we significantly increase demand for those treatments, is that we just don't have enough specialists. And that causes a problem with the mismatch between the actual demand and the supply of the treatments that we can offer. And that is the case in many areas of healthcare, including in dentistry. So if we think about the use case in orthodontics, which is where 32Co started, we have around 1,000 orthodontists in the UK, give or take, and 60 million patients. Now, when you're treating, children that have severe malocclusions, maybe that's enough. But now add on the fact that every adult would quite like to have nice straight teeth. That just doesn't make sense. The ratios just no longer work. And so you have to try and find ways to meet that demand. And so I was quite interested in how that would work, because during COVID, we saw that quite clearly with the advent of the direct-to-consumer orthodontic model, which I'm sure listeners of this podcast will have opinions on. But what it did show is that there are enormous numbers of adults who would love to have straight teeth, and we're trying to find ways to do that. And it seemed odd to me that people were going online to do this when most people should be going to their dentist, at least once a year, at least to get their teeth cleaned, if not to have a proper checkup. So why not just go to your dentist and get it done properly? Why would you take the risk of going online? Was a question that I thought was interesting. And so spending a lot of time talking to dentists and saying, look, why are you not offering this treatment to your patients? Because they seem to be going elsewhere. And a lot of the feedback that I got was the same as if I were to ask that question of a GP not providing advanced dermatology advice, which is, well, look, it's a specialist treatment. And, we have orthodontists for a reason. They get 3 years at least of extra training, and then that's all they do all day, every day. So I am hesitant to just jump into doing something that I'm not 100% sure I'm going to be able to deliver perfectly. And so that's where, I started working on this idea of what would it actually take to get a dentist feeling confident delivering orthodontic treatment across the board. So not just in a big city where, there's actually good support networks, but in the middle of nowhere, a dentist that's just graduated that goes and works somewhere where they're by themselves and they perhaps haven't had a lot of training in orthodontics in dental school, rightly so. It's obviously there's a lot to cover. What would it take? And that's basically what I've been focused on and building at 32Co. And really one of the key ingredients of that is providing the right support, the right training, and the right infrastructure to help connect primary and secondary care. So getting specialists to work directly with dentists and provide knowledge and share their experiences, so that you can get really, hopefully, the best of both worlds, which is the dentist can deliver the treatment, but they're doing it at exceptional quality, no matter where they live.
Yeah, there's so much to unpack in what you've just been saying, Sonia. And I'm not 100% sure where best to start, but I was struck by so many things that you said there. I'm one of those people that's sort of embracing the whole kind of wider view of well-being and not life-saving, life-changing, and taking more responsibility for my health. And I'm taking an interest in so many aspects, fueled in part by my Apple Watch and or the various tracking that I can do of my own health. And I hadn't really thought about the fact that that's probably creating a demand for certain advice guidance services that we're not necessarily geared up for. I think that is very interesting when you see this more polarization of the population into people that are, it feels, and I'm speaking in very general terms now, I absolutely realize, who are abdicating responsibility to the NHS to a degree, and then people that are actually taking responsibility and therefore a lot more curious about what might be out there and what their expectations should be. And I think what's interesting there is that I've long held the view that in dentistry, and maybe this goes part the way to your initial question that you started looking at with 32Co. When it comes to general dentistry, patients don't behave like consumers very often because it's all based on trust. They know they're going to turn up. They don't know that they've got a problem. They're fearing they might be told one, but it has to be trust. Whereas when they can see they want the straighter white teeth, especially in the wake of the Zoom boom and the online move, because they self-diagnosed, it's almost to me as if they feel more empowered. So if you've got that shift towards well-being and people are diagnosing themselves better, then I can see that you've got more consumerist tendencies and a growing demand. Does that sort of make sense?
Exactly. Yeah. And I think there's a point that you touched on there, which I also feel very strongly, is that those people do not have lower expectations for the quality of the treatment that they want, versus someone that is able to afford and attend, private treatment on Harley Street. So, when people are educated, they want the best for themselves. And if we all accept that orthodontics is a specialty for a reason, everybody wants access to the orthodontist who's done hundreds of thousands of cases before, but it's just not practical. So how do you meet that expectation but do it locally? That was one of the questions that we wanted to ask, and you can use technology to do that, as we've learnt. But to your point about patients becoming more informed, The second area that we've looked at, or that we're now launching with Aerox, is sleep apnea and snoring. And so when half of the population is wearing a wearable that is telling them that they're sleeping badly, some even flagging risk of sleep apnea without actually giving you a diagnosis or anywhere to go with it, that becomes a very interesting area where if you go to a GP, and I can speak now from the medical side, if you go to a GP and you say, I'm very tired and my watch is telling me I'm tired, the GP is going to be, there's a lot of things that need to be ruled out to get rid of tiredness, or to sort of try and diagnose and triage tiredness. But one of the big causing factors is obviously sleep apnea. 1.5 million patients diagnosed with sleep apnea, probably 4 times that actually have the condition that don't yet know, because the symptoms are so non-specific. I feel rough in the morning isn't exactly a very specific symptom. And so the pathways that exist today to get someone a diagnosis of sleep apnea and then first-line treatment, which is CPAP, takes probably 18 months to 2 years, because we don't have enough sleep specialists. Exactly the same problem. And quite often patients that try CPAP, I would say 50% of the time, within a year they've given up. You can imagine it's a pretty invasive, device that's quite it's intrusive and uncomfortable, to say the least. So I, as a medic, did not really know when I was training that there was such a thing as a mandibular advancement device. And I did a neuroscience degree on top of my my medical degree, focusing a lot on sleep. Right. So that just shows you how big a gap there is between medicine and dentistry, which to me is very artificial. I think they should be much more connected. So the mandibular advancement device is a NICE approved device for the treatment of sleep apnea. And the interesting thing about it is that medics cannot prescribe it, as in they can't create an oral appliance, right? Because it's a custom-made device that's worn in the mouth. So we need dentists to be doing that, but nobody is referring patients from the medical route or the sort of physician route into the dentist route. And so you've got this big gap, both in terms of knowledge and awareness in patients, but also in terms of referral pathways, which seems mad to me, pun not intended. It seems crazy that there's this incredibly effective device that so many people could benefit from, that really should be delivered through the dentist channel, that we're not delivering it at scale. And that's the next problem that we're tackling, that has the same kind of basic building blocks of, well, we need to train dentists, we need to give them access to the specialists in that field so that they really are doing the right thing by the patient, not straying into diagnosing, making sure that we are triaging patients in the right way. So yeah, that's another really big area where there's a huge amount of consumer understanding that there is a problem, but not a huge amount of awareness around the solutions available.
Yeah, I mean, that's so fascinating because I'm one of those that wakes up and almost the first thing I do now is check what my sleep score was. And I know I'm not alone. There's loads of people who do this. And it's one of those weird pub conversations now where you can be talking about how much deep sleep you had the night before and things, and with a quantification of it, not just it would be a good thing to have type of discussion. So it's definitely, I think, awareness of it as an issue and the importance of decent sleep when it comes to your overall well-being. I think you're absolutely right. I mean, that's growing, and yet I'm not too sure that it's easy to know what to do. I mean, I sometimes struggle. Sometimes I'm thinking, what changed there? What happened there? And so I think it's an absolutely fascinating thing, and I think one of the things that I felt for ages with dentistry is that we underestimate its importance to wider healthcare. And there's lots of people that have explored the same sort of theme as I'm just about to. But one of the things that I find really distressing is the fact that we talk about the fact that only 50 to 60% of the population go to the dentist on a regular basis, as if it's some huge failing. Whereas actually, for me, I'm turning up for a dental examination, I'm turning up for a health screening. I'm not sure how many other health screens get 50 to 60% of the population turning up. And rather than using pressuring people through nice guidelines to try and push out to the recall intervals. I feel like we should be harnessing that habit of regular attendance we've got in a much wider, holistic, well-being way than is currently being done. So this idea of sleep apnea and that being a logical thing for your dentist to explore, and they get the chance to do it on, once or twice a year for most people. I mean, it just seems a really sensible thing to do. So when you're looking at the barriers, I mean, we over the years, we had a lot of talk about defensive dentistry, and particularly new graduates seem to be coming out of dental schools having had the fear of God put into them about their likelihood of being sued or complained about, and how the GDC can be quite heavy-handed. So it feels like they play things very safe because they're worried about overstretching themselves. Is that the kind of barrier that gets in the way of diversifying in the way that you've been describing today?
Yeah, there's a couple of different things on the sleep side. I think the first is a lack of patient awareness that this is even a problem. Because I think if you had patients showing up to the dentist and saying, "Look, I've heard that you have these devices that can help me with sleep apnea," I think the market would have shifted by now, and people would have started to look at it and say, "My patients are asking for this. I feel like I should go and find a solution, and I feel like I should invest in this." That hasn't happened because patients don't know. So that's barrier number one. And I think we're doing a lot on the AOC side to do research and to do a lot of press and media around educating patients that there are these solutions available, and they're available through the dentist, to try and elevate their position in this discussion. But in terms of adoption from the dentist side, we speak to thousands of dentists that use 32Co and say, "Look, what is it that's stopping you?" And it's exactly the same thing. It's, I am not sure that I know which sorts of patients are suitable. We're now talking about something that really is outside my comfort zone because it's medical in nature, and I've been told I'm not allowed to diagnose medical conditions. And I just don't want to get it wrong. So if no one's coming to me and asking for it, then I'm probably just going to sit on the sidelines and not participate in this. So there's quite a few steps that you need to undertake to try and break down those fears. And we do it in AOC in exactly the same way as we did it with 32Co, which is you have to start with the clinical confidence and the clinical rigor. So there is no point, and this is something I spent a lot of time talking to non-clinicians about, who don't really understand why aren't dentists doing this, or why aren't doctors doing this. And it's because the equation in your head when you are treating patients is not an economically rational one to many other people. I say, if I were to say to a dentist, "I'll pay you £1 million to inject this into a patient's gums, or and I promise you it works," your dentist would rightly say, "Well, I'm not taking £1 million. I have no idea what this is. I can harm this patient. I'm not 100% sure that this is going to be the right thing, so I'm not going to do it." So you have to overcome the clinical fears and reassure people that nothing is going to go wrong. We're going to look after you before you can even think about talking about commercial confidence. And so you have to train people. You have to give them the foundational knowledge so that they feel like they have a bedrock of understanding. Are you going to turn them into a sleep specialist overnight? No, that's not the point. You're going to give them enough knowledge to understand the foundations, and then it's important that you link them up with experts, right? So that's what we do in ortho, and that's what we do in sleep as well. Is link them up with a person that has got the knowledge and the experience to guide and mentor and help them triage patients that are suitable. And you can do that with experts. You also do that with technology, which is also what we do. And then you get a clinician to the point where you say, "Actually, do you know what? I feel confident doing this now. I feel like I understand what I'm doing, and I feel like I've got a safety net, and I feel like I know where to go if I need help." Then you can start unlocking, okay, well, now how do we start actually providing this in practice? Because this is a whole different commercial and workflow challenge. Unfortunately, and again, we are working on this, the NHS does not yet fund mandibular advancement devices, partly because there are not that many dentists doing it. So why would you make a big pot of money available if no one is able to offer it? Or there's patchy coverage, I think, across the UK. So there is an element of having to communicate with patients about, the cost and how it's all going to work. And so that the sort of workflow, the commercial workflow side of it is the next thing that you need to give time and energy to helping with. And then once you've got those things, then you have then you have somebody who hopefully feels like they're confident, they can start talking to patients about it and actually delivering it at a very high standard. But it's not one silver bullet, as you can imagine. There's lots of things that need to go right, and you need to earn the trust of your clinician base before you have a right to do that.
Yes, I'm sure members of my team listening to this will be smiling wryly at your use of the word trust, because that's something that I talk about consistently, because it underpins everything in the world of dentistry, I think, but particularly the patient-dentist relationship. And then the dentist doesn't want to do anything to damage that trust by being heavy-handed or slightly clumsy about how they go about things. So I totally see, and after the many years I've spent with the profession, that point about needing to give them confidence that it's the right thing and in their patient's interest. And I guess that's a really important thing, because, as I say, as you see the importance of sleep quality being raised up the priority list for an awful lot of people, I mean, it can be life-changing for people sorting this issue out. It's not just a mild inconvenience, is it?
Absolutely. No. And I think philosophically, for me, the sorts of treatments that we want to be able to offer in this way are in the category of life-changing, right? This is not something small that, because also these treatments do cost money and they are expensive. And so we have to make sure that we're providing real value. So when you talk about someone who has been miserable because they're so tired all the time, and they've been diagnosed and been told, well, you either wear the CPAP mask or you get nothing, because unfortunately that's all I can offer you. You're living half a life, right? Prof Johal, who is our clinical lead, talks about patients who say they live like zombies, and it's very hard to quantify the impact of that, other than just by the sheer frustration that people have with the lack of quality of life. You then give them one of these devices, and we've treated these people and had this feedback consistently, which is, I feel like a new person. It's not something visible on my arm or on my leg. I just feel like a new person, and I can't believe that it took me this long to find this very simple device that all it does is move my jaw forward and keep my airway open. And so, we've done some research in the last couple of months to try and again explain the impact and to try and put it into terms that people understand. So when we started offering Aerox, we were getting patients who were saying, the reason I want this, and we haven't touched on snoring yet, but we should, the reason I want this is because I snore and I've tried everything, and I sleep in a separate bedroom, and I'm doing this for my partner, actually. I'm usually it's a husband doing it for the wife, and coming back to us and saying, 60, like, I'm not sleeping with the dog anymore. I'm back sleeping with my partner. And that is, again, how do you quantify that? And so we did a survey of 1,000 divorcees and asked them what were the various causes that they sort of attributed to the divorce. And 47% said that snoring was a contributing factor. And I think we joke and smile a lot about snoring, and it's often the butt of the joke that people snore. But it's not funny if you're living with it or if your partner lives with it. There are two patients actually now in this condition, right? You've got the sleeping partner and you've got the patient themselves. So being able to, as a dentist, change someone's marital status for the better. It doesn't really get much better than that. And most people that I know that went into healthcare, the healthcare profession, did it because they wanted to have an impact on people's lives. So if you can both improve someone's smile to the point where they're confident in their smile, and then improve their sleep to the point where, their relationship is repaired. I mean, that's pretty life-changing stuff.
Yeah. I can relate to that in terms of my own career. I mean, most of the dentists I worked with early on in my career were coming to me saying, Nigel, I'm giving up dentistry. I've got to try and work out how to develop a successful private practice because I can't stay in the NHS as I'm doing it. And so that's what a lot of my career has been around. And I have had people say to me, thank you for saving my marriage. I've had people say, thank you for saving my relationship with my kids. I'm able to talk to my kids, and as well as my professional career and all that. And I think the interesting thing when you, in the context of this conversation about sleep apnea, is if you're so fatigued, like you say, you're walking around like a zombie, what decisions are you making about other aspects of your health? What nutrition choices are you making?
Yep.
And so there's sort of like the the root cause of what could be some poor decision making for your wider health could be utter fatigue. So it's I think I can
Absolutely.
see why it's so important.
Absolutely. So untreated sleep apnea has so many consequences in terms of long-term metabolic health, cardiovascular disease, stroke. It's not even a question about whether it essentially reduces your life expectancy because of these downstream impacts. And then there are certain professions as well where it's even more impactful. I mean, if you work in the healthcare sector yourself, let's say you're a nurse and you're exhausted all the time, we see, for example, people who drive for a living who are not
Yeah.
allowed to drive anymore because they have sleep apnea, because it's a risk. So again, it goes beyond the sort of lifestyle, type problem into something that is fundamentally changing the way that you work and that you interact with people and the way that you live your life and perform, basically. And
Yeah.
it's not complicated to have a device like this made, custom made to your mouth by a professional dentist. That it takes a little bit of time to get used to, but in the long run is going to be game changing.
Yeah. I mean, it's so interesting, and like I say, for a long time now, I've been thinking about how we harness that regular attendance for much wider healthcare benefits, and I think it links to what you said before about why people go into the dental profession in the first place, which is quite often to change lives. And it's an incredible privilege, I think, for people who can have their self-confidence improved so much that their careers or their personal lives are transformed. And then this feels like an extension of that philosophy where you can really add value to your community in a way that not many professions, not many roles really allow you to do that. So I think it speaks to the purpose of being a dentist or being the owner of a dental practice. But that then makes me question one of your very opening comments, which is that to do with the sort of compartmentalization that we have, where we have these different disciplines. And
Yeah, makes no
yeah,
sense. I agree with you. I think that the more time I spend, in dentistry as a, initially, I suppose, as a guest, right? I was coming in and asking all the dumb questions and saying, look, help me understand, in what ways is it the same as medicine, in what ways is it different? And I am increasingly of the opinion that the divide is so artificial, and it makes no sense in 2026 for us to be thinking about the mouth as a different, completely abstract part of the body. Because while dentists may feel like they don't get a huge amount of training on things like cardiac disease, which is linked to the mouth, and gut health and things like that, the same is true in reverse. If you open a medical student's textbook, it's like the mouth is like it's missing. There's not anything about the mouth, apart from we talk about the facial nerves and then we sort of ignore what happens inside the mandible and the maxilla. It's just completely mad to artificially separate them like this. And increasingly, I think we're seeing a tendency towards bringing those together and trying to understand the mouth as the it's an entry to the body, and it's an early warning sign for so many conditions. And we now understand deeply, or more deeply, the connection between things like perio disease and Alzheimer's and things like that. But we need to actually empower our clinicians to do something about that. Right? It's all very well publishing papers on it and in theory recognizing the link, but so what? What changes tomorrow? In what changes on Monday morning about the way that I practice that's actually going to help me make a difference? That's the link that I think we need to make, and that's what I'm very passionate about trying to make happen.
Yeah, well, I mean, that passion comes across loud and clear, and I couldn't agree more with what you're already doing, not aiming to achieve. You're achieving it with all of those dentists that you're working with on the orthodontic side, and increasingly so on the sleep apnea side. I think this is such a fascinating area, and when I look towards the challenges that will be impacting how we provide healthcare in general over the coming decades, it feels to me that this might be a conversation that isn't being held in many places, but it's got to start happening in lots and lots of places if we're going to be able to create, I say that kind of the combination of the population taking responsibility by feeling empowered with knowledge, but then the what next for both professionals and patients, the easy next step. I mean, you can, I've spent a lot of my career talking about the change equation, where to overcome resistance to change, you need sympathy with your current situation, a vision of what it could be, and then an easy first step. And if you're missing any one of those three, it won't happen. So it sounds like what you're doing very successfully is helping address that easy first step for both the professionals and the patients. So it's been absolutely fascinating talking to you, Sonia, and we could, I think, carry on for quite some time. So hopefully you'll come back again, and we'll do a part 2 and see where things have got to. But thank you so much for giving up your time today.
Thanks, Nigel. I'm very happy to, of course.